Hello, and welcome to Animal Chiropractic Clinic Chatter, a podcast where Dr. O from All Creatures Every Spine interviews doctors and animal owners that utilize animal chiropractic to get their unique perspectives. Yes, it's really a thing. Dr. O utilizes his 30 years of experience as both an animal chiropractor and veterinarian, and to dig deep into the discussion of complex issues affecting the lives of your animal friends and companions. Join us for this educational episode. Thanks for joining us for this portion of the episode as Dr. O begins to answer the question, what is animal chiropractic? He will look at how the chiropractic adjustment is a valuable and viable treatment for what ails your animals.
When an animal's nervous system gets overloaded, it's like tripping a circuit. In the circuit breaker in the box, ours are in the closet, some people's are in the garage, wherever. That's a subluxation. And if you don't change anything and you simply go out and switch the breaker, does anything happen? It blows again. All right. Same thing happens with your animal's nervous system. The animal's job is to do its best to adapt to physical, chemical, and emotional stress in their life. Our job is to adjust your animal's spine, reduce nervous system interference, and permit a free flow of nerve communication between your animal's brain and body to facilitate this adaptation. Your job is to help that happen and make sure that we've identified some stressors that might be causing the vertebral subluxations, and you help your animal maybe train a little bit better. Maybe adjust their diet a little bit better. Maybe spend a little more time with them. Whatever you identify and we identify as the stressors for your animal's body. Maybe don't have them jump off the 4-foot bed. Help them get down off the bed. Maybe, all kinds of things that we can do. Target exercises. So anyway, that's what animal chiropractic is about, and that's how it's going to help your animal get better. But it's not a one-sided team. It's not a one-side team. It's a multiple aspect of the team. All right. You're part of that team. You're part of your animal's healthcare team. So make sure you take an active part in it.
Make sure to visit our website, allcreatureseveryspine.com, where you can subscribe to the show and learn more about getting your animals adjusted. If you are in the Meridian, Texas area, drop in on a Tuesday afternoon to get your animals adjusted. If that isn't possible, schedule a consultation on your animal's health with Dr. O. You can also purchase a copy of Dr. O's book, Yes, It's Really a Thing.
Heroes come in all shapes and sizes. For me, my hero is Frank, my best friend. But even the greatest heroes need help sometimes. Frank and I were at the park the other day when he started limping and favoring his left leg. I didn't see what happened, but I could tell something was wrong. So we went to see Frank's favorite vet, Yvette. Yvette the vet. After running some tests, she determined that Frank had torn his ACL. His best option was surgery. But unfortunately for me, surgery wasn't an option. So what could I possibly do to be a hero to my hurting hero? That was when Yvette told us about hero braces. She took a quick cast of his leg and said this mold would be used to create a biomechanically designed stifle brace, custom made just for Frank, allowing his body's natural healing processes to take over and stabilize the knee. About 2 weeks later, she fitted the brace and gave us the green light to walk, hike, and snuggle, and do all the activities that Frank and I were used to doing. It was that simple. Hero braces are lightweight, don't stretch or tear and are durably designed to last the life of your dog. So Frank can get back to being Frank. Like I said, heroes come in all shapes and sizes. And lucky for us, so do hero braces.
Your active dog needs more than water to rehydrate. Replenish Dog Water Supplement is an all-natural powdered water flavoring, prevents dehydration and provides vitamins for your dog. Created by a veterinarian and rooted in science. Give your dog the care they deserve with Replenish.
Hello everyone, and welcome to barfworld.com. If you're seeing this video, it typically means you're interested in trying our 90-day challenge. If your pet is suffering from allergies, kidney issues, obesity, diabetes, or even cancer, our food can help with that. So if you're ready to see your pet's health dramatically improve in just 90 days, call us and schedule your consultation today. Hope to talk to you guys soon.
Join us as Dr. O interviews a certified chiropractor, veterinarian, or an animal owner. These enthusiastic people explain how they utilize animal chiropractic to alter the lives of the animals in their communities.
Hello, everybody. Welcome to another episode of Animal Chiropractic Clinic Chatter. I'm your host, Dr. O. Today, we're here with Dr. Tarek, and why don't you tell us a little bit about yourself and your practice, sir?
All right. Yeah. Thanks for having me, Dr. O. Glad to be here this morning. So I'm Dr. Tarek Isham. I'm out here in Montana, Clyde Park, Montana. It's east of Bozeman, north of Livingston. And just starting up a integrative medicine practice out here for all species really, but focusing on our dogs and horses. We offer chiropractic and acupuncture and nutritional consultations. We employ, all kinds of integrative modalities, and definitely really happy to add chiropractic to the tool belt. It's been a great journey.
All right. So what's one of your biggest wins with animal chiropractic so far?
So definitely the success that I see with our geriatric population, and had an elderly German Shepherd dog, and after a few treatments, those unexpected results are really always so happy to see that, both me and their person. So with this dog, mobility improved, hind end strength and all of that, ability to rise. But beyond that, what was really great to see is what her person came back to me and told me was, I'm so glad to see the spark return to the eyes. I'm so glad it's like the dog is, that the dog I used to know, more present, more engaged, happier, more energized, just that spark returned to the eyes, and how much joy that can bring, the people that dog is around and touches every day.
Yeah, and we could get into the science of why that is. We remove some pain, and that helps the nervous system function better as a whole. And we could get into the philosophy that the body heals above, down, inside out, and when chiropractic allows the nervous system to function at its utmost, and we could get into the art about how you remove the vertebral subluxations that were necessary for that animal to function correctly, and we could get into all that. But the bottom line is that if you know those things, the German Shepherd doesn't.
Yeah.
I mean, like when I go to my chiropractor, we talk about those things. And we talk about what he's adjusting and why he's adjusting it and where I hurt and what I feel and all that kind of stuff, right? And I feel better. And and there's people that come in and they say, well, I went to a bad chiropractor. I'm like, okay, well, find a different one, because it's not about bad or good. It's about getting the vertebral subluxation removed. And so if you went to a chiropractor and he was unable to remove that vertebral subluxation, then he was not the chiropractor for you. That doesn't mean he's a bad chiropractor. It just means his art didn't work for you. But when we work on these dogs, they don't care about the science, the art, and the philosophy of chiropractic. They just care.
Yeah, I mean, it's really shown me a lot of light since graduating vet school, that you see results that you see, so-called non-believers, or a lot of times I'll get the comment, it's like, well, what's really amazing is that my husband sees a difference, and he doesn't believe in this stuff at all, kind of, which I've heard a couple of times,
Yeah.
There's not the placebo there, and it's fascinating to me that to look at the peer-reviewed studies too, and on some of this stuff, and see, animals are just truth tellers. It definitely makes you feel like you're on the right path there, and you're using the right healing modalities.
Well, and one of the things that I talk to people about, like, so when had somebody the other day wanted to know, should I come see you or should I go see my regular vet? And I'm like, well, I'm in a unique position, and I'm not just a chiropractor, just like you are. So we can do it all if we want to. Now, I choose not to do anything but chiropractic, and you do a few other things. But, I'm not set up for surgery, and I don't think you are. And I don't have an x-ray machine and ultrasound and all that. But I do know when one's needed.
Mm-hmm.
And most trained animal chiropractors are in the same boat. They know when an x-ray is needed. They know when something's not working. And so if you go see the animal chiropractor first, a trained animal chiropractor, all right, they know what is not chiropractic. And unfortunately, like you alluded to earlier, most veterinarians, we didn't learn anything in vet school about chiropractic, about acupuncture. And so there's a lot of, like, I'm sure I was in that boat when I got out of school. Oh, no, don't go try a chiropractor, because it may not work, Well, all right. So what happens if it doesn't work? We haven't lost anything. Whereas, I had a dog come in here the other day that had been to the veterinarian first, and they put it on 2 different drugs, and they'd called and made an appointment. We said, yeah, please take them off the drugs before you get here. And so they came in and they said, we're sorry, they're still on the drugs, because our veterinarian said, oh, don't take them off the drugs. I said, what'd they say about the chiropractor? Well, they didn't recommend we go. I said, all right, well, how are the drugs working for you? Because if they're working, well, then maybe we should leave them on, right? Well, we're maybe getting a little worse. And I said, oh, really? Yeah. So we looked up the drugs, and I'm not going to mention anybody's name on here, but both of the drugs that the animal was on cause ataxia and gait abnormalities as a potential side effect. And the reason the dog went to the vet in the first place was because was having trouble walking.
Yeah.
And
I don't think it's stressed enough in your regular vet visit, that one of the tenets of Western medicine, which is you don't get something for nothing. And anytime that you might get a benefit, you also have to recognize that there is a potential, if not a certain harm that you're going to be inflicting at the same time. And again, that's just why I love these modalities, is because that tenet just does not hold true. You can in fact, improve mobility at the same time as increasing metabolic function and supporting the kidneys and liver, and as opposed to taxing those organs in the processing of your pharmaceuticals. So yeah, it should really be stressed more, because it's just a fact, and that's something that traditional doctors, human and animal alike, I think the best ones recognize that fact.
Yeah.
Yeah.
And and I've know people, that my folks and my in-laws and some other people, that on multiple pharmaceutical agents. And when you ask why, well, I'm on this one because that one causes this. And so now they put me on this one, which caused this. So now I have to take another one, and it causes this. And it's like, whoa. And I was on the FDA, the Food and Drug Administration website the other day, looking up a side effect of a medication. And right on the bottom of their website, it says that these are just the side effects we know, and there is no way that we can foresee all the potential side effects of drugs and drug complications in your body. So please let your doctor know. And I'm like, okay, you're the guinea pig.
Yeah, at least they're being honest, and that's
Well, and they are, but I cringe sometimes, because we make sure that we go over all the side effects, and we tell people that animal chiropractic is an alternative modality, and it's not veterinary medicine, and the side effects are slim. It may not work, is probably the worst one. But we make sure that everybody knows that, because in my veterinary practice act that in Texas here, it says that before I start a treatment modality, I must let you know all of the choices and what the possible problems are. And these people come in with drugs all the time, and I'm like, oh, that one causes this problem. And I'm sure your vet told you that, and they just look at me like, no, that's the first time I've ever heard it. And I'm like, oh, well, I'm sorry. Well, this is what it causes, And sometimes it's amazing how, as professionals, we forget some of those things and forget to look at the animals. I had a dog in here it was about time to put him to sleep. I mean, from a lot of standpoints, quality of life being the main one, and his quality of life was pretty low. And he was getting adjusted once a month, whether he needed it or not, which was not enough for him. And he had some symptoms of myasthenia gravis, which includes not being able to swallow. And so he wasn't eating very well. He was getting some problems. And so came in for their monthly visit. And I said, man, we're really, really not doing very good right now, are we? And she goes, no. She goes, she's really been acting drugged up since the last medication increase. And the medication just really doesn't seem to be working. And we've increased it 4 times in the last month. And And I said, well, what's the medication? And I went and looked it up, and I read the side effects. She said, yeah, that's exactly what he does. So they increased the dose. I said, no, wait a minute. I was reading the side effects, not the treatment. And when you went and read the treatment, you should use this drug to treat these 4 things. However, it might cause these 4 things. It was like, okay. So we totally took the dog off. It was only like 2 cc's a day, and we took it down to like a quarter of a cc a day, and the dog lived for another year and a half. Who knows, right? So yeah, you have to be willing to explore. So
Yeah.
So what about any horse stories? You got any horse stories?
Yeah. Last patient I saw, it came to me really more because the owner of the horse wanted to learn about some mobility exercises, get the horse loosened up and ready for competition. So yeah, that's actually some of my favorite cases, honestly, because I love teaching. And I also think that it's great, and the horse loves it, so we go through, the chiropractic adjustments that the horse needs. And then I show the owner the most relevant stretches for that horse and joint mobilizations, which are often the same exact setup that you use for a chiropractic adjustment. You're just not doing the thrust. You're taking the joint to range of motion to tension.
Right.
And it'd be specific for each horse and what they need, and also not to, depending on the owner, how much they can take on. Sometimes it's just one movement. Sometimes it's a few.
Right.
But she was an experienced horse handler, and had worked for a veterinarian too. So I was able to show her some really relevant stretches for that horse, joint mobilization, and yeah, she told me that it's loosened him up and he loves it. Licks his lips, gets relaxed, gets kind of, that's like the routine before competition, and hopefully, 3 to 5 times a week,
So yeah, before not only competition, but I don't know how close you are, because my geography's iffy, and I'm not really sure that Yellowstone is filmed in Montana, but but anyway, I was watching an episode of Yellowstone, and I was like, man, those ranch horses really need routine chiropractic care. I mean, if I was on one of those cowboys, because one of the things that we do for horses is we do our 12-point safety check, and just teaching, any cowgirl to do a 12-point safety check before they climb on and ride in the mountains. I mean, all we do is make sure they know where their feet are. You go wide and they bring it back. You go cross and they bring it back. And so they know where their legs are. And it's like, man, can you imagine if one of those horses that was riding in the mountains and going over those rocks and chasing those cattle didn't know where their feet were? And so even though they're not in competition, these ranch horses, and in fact, I know an animal chiropractor that has like he goes to one place. He spends like 3 days there, and he does a little over 40 horses plus a couple dogs and some other stuff. But every month he goes out and he does all the ranch horses. And it started with just looking at one lame horse, you know. But like most of us do when we're there, we show me chiropractic. We show before, we show after, we give them some exercises to help make the horse stronger, and just looking at those things, you know, and doing that are huge. And I do a couple things. I'm sure you do. We do what we call a butt tuck, you know, which checks collection and hind end range of motion, and then we do some neck stretches. And then we do the 12-point safety check. And if your horse doesn't need a chiropractic adjustment, on Tuesday afternoons, we do that. And that's free on Tuesday afternoons at our place. So they haul them in here. I don't go to your place for that. But if you haul them in here on Tuesday afternoon from 1 to 6, we do a free chiropractic assessment, free spinal check. Now, I will tell you that in 12 years of doing that, I've seen 2 dogs and 0 horses that were perfectly able to function like that. Now, I had one lady say no, she didn't want her horse to get adjusted and she just left. But most people, when we show them what they can't do and explain to them why those motions are important, they're like, sign me up. And then they become routine patients. Some of them not as routine as we'd like, but that's okay. They know what to check for. And, you know, and when I read on Facebook, you know, that, oh, I was out trail riding this weekend and my horse fell on me. Go look and see, well, when was the last time that horse was adjusted? Oh, man, it's been over 3 months. I bet she didn't do a 12-point safety check before she climbed on. So, you know.
Yeah, I like to do, you know, physically, if it's a first patient, a physical exam, and definitely check all proprioception. And so a little bit more involved on the nervous system than your traditional physical exam might be. And then adjust the atlas if they need that, and then talk about, you know, nutrition and some next steps.
Yeah.
And that's generally the first. And if it's, you know, a patient that you haven't seen for many months and hasn't had that, then do it again, you know, make sure.
Yeah. People, is that all you're going to adjust, the atlas? What do you mean that's all I'm going to adjust? That's like a world to that animal.
Yeah.
I was into the taxidermist today, and he had a new atlas for me because I'd talked, and I was like, oh, this is so cool. And looking at it, it was a Nagai, which is a kind of elk down here. It's a elk from India that was imported, and now they're considered a invasive species. But anyway, I was like, wow, okay. So now I have a Nagai. And he says, you don't want more bones than that? I go, no, this is it. I have and so now he's going to get me. So he spent about, I don't know, 15 minutes talking to the taxidermist about the importance of the first cervical vertebra. And he was like, well, okay. And I said, well, like a predator has to be able to see everything. They have to be able to look up. They have to be able to see everything so they know where the prey is, so they can time their leap right, so they don't go hungry, you know. And they said it's so important because and then their jaws have to be able to open to the fullest, and they have to have that crushing bite, you know, in order to succeed in what they do for a living. And I was like, oh, wow. And I said, yeah. And I said, even though, you know, the optic nerve, the eye nerve goes right to the brain, the looking sideways, the, you know, being able to tune that to the ears so that when you hear a noise, you can look and pinpoint where that noise is and all that. And I was, oh, wow. And I said, and like, then the other animals that you have in here are all prey animals, and they have to be able to relax enough to eat. And the only way they can do that is if their eyes and ears are, working at 100%. And so, that is so important, because we know that the weight of a feather decreases transmission by 40%. And they were like, whoa. So anyway, now they're like, well, we've got this coming in. Do you have one of these? Do you have one of these? So I'm going to go back in next week.
Yeah.
And get more atlases.
Yeah. That's cool. We've been slowly collecting specimens as well. Some atlas, if I see an atlas or a skull, then I'll grab it. The other day we saw one where the occipital bone was still there and the atlas was fit right inside of it, but the skull was gone all around.
Oh, cool.
That was kind of strange. Yeah, and got a moose recently, so yeah,
we were at the woolly mammoth museum here in Waco. Well, it's the Columbian Mammoth Museum here in Waco, and we were looking at them, and they had some bones, laying around. Of course, a lot of them are still in the pit. It's one of the cool things about that museum is that they're leaving everything. Well, I'm sure they take it out in catalog, but they put it back where they found it. And so when you walk in this building that's above the dig, they actually built a building around the dig. And so you're up on top and you can look down in the hole, and they're down there. But they have some bones on the side, and I'm looking at this one woolly mammoth and her skull, and her occipital condyles are not even. They're like asymmetrical, and her tusks are asymmetrical. And so they have this story of how the tusks are probably asymmetrical because she broke one in a fight or whatever, blah, blah, blah. And they really can't prove any of that, but they're all well formed all the way out. And then there's another woolly mammoth that had a broken tusk, and you can see when it broke and it grew out, right? And I'm like, well, maybe the actual problem was here first, and we got that asymmetrical occipital condyles, and then the tusk couldn't grow right, and the paleontologist kind of looked at me like,
maybe.
maybe
Can't say you're wrong.
Who knows? You could be right. And I'm like, yeah, okay, maybe could be right. So yeah. Anyway, so who knows? So any last words of wisdom you have for our listeners out here?
Stay vital, stay adjusted, and new year.
All right.
Yeah.
What would you tell any veterinarians that are thinking about adding chiropractic?
Yeah, I mean, I think all the way, it's an amazing modality that once you see the importance of the nervous system and the housing for the central nervous system, that we can influence that. It's essential. It's an essential tool to be able to influence that. With today, with all the toxins and all the other causes for those things to get completely out of whack, that we can bring it back is really important.
All right. And then last but not least, how do people get a hold of you?
So website should be ready to go when this airs. Lookingglassvet.com, and my information's up there.
All right, lookingglassvet.com. All right, thank you so much. Thanks everybody for tuning in again. Remember, the body heals one way and one way only, above, down, inside out. Keep those atlases adjusted and everybody's going to do great.
Thanks, Dr. O.
If you are or know a veterinarian or chiropractor, or a student of either of these professions, visit our website, Animal Chiropractic Education Source, to see how to become certified in animal chiropractic. Start improving the lives of the animals around you. Thanks for tuning in. Be sure to subscribe to the A.C.E.S channels so that you never miss an exciting episode.